Safi, and this is another Ask Dr. Safi video. If you have been asked to get a brain MRI for your child, then this video is going to be for you. See, a few days ago, a family brought an MRI for me to look at and review for their child, and honestly, when I saw that MRI, I was a little bit frustrated at the situation. The MRI was so blurry, kind of like this picture here. It's really hard to make out exactly any sort of picture or view of the details, and that worried me because this is a test that costs thousands of dollars, and it takes up a lot of time, and there's a lot of stress, concern, and anxiety. And I'm a child neurologist, and I review a lot of brain MRIs. I see a lot of children with brain conditions, brain fog, attention disorders, headaches, even brain tumors and seizures. And so I see a lot of brain MRIs, and this is an unfortunately common situation where children are going to get brain MRIs and their families don't understand the basics of the MRI process and really what they're getting into when they're getting an MRI, and actually what they're getting out of when they actually get the image and the MRI itself, and that the images come out on a CD for them to take for their neurologist to review and for them to keep in their records. And so really I'm going to talk a little bit about the MRI process, the brain MRI specifically, what's important in that process, and really the things that, if you're a family member who's getting a brain MRI for your child, what are the things that you need to be paying attention to. See, the difference between an MRI and a CT scan or an X-ray or another type of imaging procedure is that an MRI involves magnets, and it takes pictures of the brain specifically using magnets, not X-rays, so it doesn't involve any radiation. It also differentiates itself because it is much longer. So a typical camera, you can just snap a picture. Even an X-ray, you can just snap a picture of a bone or a head, but the MRI requires you to be very, very still, and it can take up to 40 to 45 minutes even just to get that MRI sequences of pictures completed. And so I always recommend families to consider that the length of the imaging sequence can be much more longer than they were expecting, and they really need the child to stay still. So these are the main considerations when getting a brain MRI. Is, does your child need sedation or not? So if a child is very fidgety, they're continuously moving around a lot, they're a young child, can't stay still, gets anxious in closed spaces because it can be very loud, I highly, highly recommend children to get sedation with their MRI, and that's actually being consciously sedated so they are remaining still during the actual procedure itself, so you can get high quality, crisp and clean images during the MRI. The other part of getting an MRI is understanding the protocol behind the MRI. See, an MRI is done with a series of different sequences, what I like to call in Dr. Safi speak cameras. So you have like the T1 camera, the T2 camera, the diffusion weighted, the ADC, the susceptibility weighted. There's so many different sequences that the MRI is done, and they're done on different angles. So the pictures are taken at different angles. They could be at this angle, the axial angle, the sagittal angle, and then the coronal angle is another. So there are multiple different angles that the MRI can be taken from as well. And so MRIs done for different purposes, like an MRI done for seizures, might be a completely different protocol than an MRI done for headaches. And so it's really important that a child going for a brain MRI, that the family understands whether or not they need sedation, or whether or not, or what exactly is the protocol of that MRI. So I hope having these questions in mind can help you as a family member taking care of your child who's going to get a brain MRI really have a better understanding of the process of the MRI, and help you to distinguish the appropriate facility that's going to help take care of your child and work with them through that. The last portion of this is making sure that after the MRI is completed that you actually get the CD itself. Now, God bless neuroradiologists and radiologists who look at MRI. They look at images all day long in a dark room. But as a neurologist and a brain specialist, I like to make sure I take care of my patients in the best way possible. And that means I look at the images of my patients personally to make sure that because I personally have seen my patients, I personally have seen and examined them and know why I'm ordering that test and for what reason, what is the information I'm looking to get out of the imaging sequences themselves. So I like to personally look at the images themselves. So I always highly recommend that family members get a CD of their child's images. I mean, they paid thousands of dollars for getting that test. You might as well get the CD and have the neurologist review it, like myself, and then hold on to that CD for future reference. So I hope this this video explained a little bit about MRIs and the processes that go into it and what are the really important things that you need to be aware of. And look forward to seeing you again in another Ask Dr. Safi video.